Worcester, Ohio. September is Healthy Aging Month. So we're going to talk about healthy aging, some of the obstacles we're going to try to avoid in the context of our pillars of healing that we discussed in our first episode. So the pillars of healing are identifying the insult or illness that may be plaguing you, doing things to boost the immune system, reducing inflammation, and then integrity. I know that one of the big fears that many of us have when it comes to aging, it's not getting old, it's how we age and how our brain is functioning. It's the fear of dementia or Alzheimer's. I think most of us have probably had a family member or a friend afflicted by that, and it's pretty heartbreaking to see someone's personality fade and to see the person you've known and loved for so long go away. So if we were going to go by our like traditional Western medicine model and you say, what is the illness or what is the insult? You would say, oh, well, it's dementia. But we don't stop there with integrative health or with the functional medicine model. We want to find out what caused the dementia. It's not something that just randomly happens to some people. You've got to dig deeper. There are a couple of different factors that I'll throw out there as a beginning to look at. One of them is genetics. I mentioned in our first episode my love for genetic testing, specifically functional genomics, and I rely on the company Intellig's DNA for that test. I'm going to give you an example of some results we've found for some recent tests that will give you some insight into how genes can affect aging. And what you want to remember with functional genomics, this type of genetic testing, is none of this is a death sentence set in stone. If you have the risk factors that they test for, it doesn't mean you will develop that illness. It means that you're at risk for it. But every single gene tested is linked to research about what you can do to work around it. So one thing that's tested is Klotho. So Klotho is a protein in your cell membranes. It's part of your body's antioxidant system. And Klotho, by the way, is Klotho. So if you have low Klotho, you're also going to have low SOD, capital S, capital O, capital D, which is superoxide dismutase. And those are really important for clearing oxidative stress from the body. So low Klotho or low Klotho expression leads to the low SOD levels. It can contribute to decreased muscle strength, kidney disease, all sorts of things. And it's highly associated with dementia. But like I said, there's research there that tells us what you can do to work around it. So one thing that is free that everyone can do is exercise. Aerobic exercise and resistance training can be protective. And remember, with exercise, it doesn't have to be perfect to be good. You don't have to be Jane Fonda. You don't have to look great. And it used to be leotards in the 80s. Now it's yoga pants. You don't have to look great in any of those things for exercise to help. Definitely, diet can make a difference. You want lots of fruits and vegetables, especially cruciferous vegetables, which are like onions, avocados, broccoli, cauliflower. But then supplement-wise, if you want to dig into that, Resveratrol is a fantastic supplement. It's a type of grapeseed extract. Resveratrol, one of my favorite brands is Vinia, Vinia. It is a long-acting resveratrol, and we'll have links in the notes to where you can purchase that. But those are a couple of things you can do. You don't want to wait until dementia sets in, or if it's already started, you can still turn the clock back a bit. But that's one example of how genetic testing can help. Another thing that we can find through our genes that I mentioned at our last episode is our body's ability to process nutrients and figuring out what our body's specific need is. So the cheap way to do this, even without genetic testing, is you could ask your care provider to test certain nutrients for you. So I would recommend that everybody get their B vitamins checked, not just B12. B12 is a good start, but all of the B vitamins can be checked through your regular lab, can be ordered by the hospital. But we will talk about B12 because it's so critical. So B12, it's important for forming red blood cells, but also it's used to clear something called homocysteine and is really critical for proper brain function and neurological function. Neurological function is your nervous system, your brain, your nerves. So it can affect pain, memory, cognition. And low B12, it's not usually a single cause, but it's associated with Alzheimer's disease and vascular dementia. So most providers, I think, if you asked to check a B12 level, would be willing to do that. Something of note, if you are looking at your lab results, so if you're looking at your B12 level, and I think the normal range, exactly what it is, depends on which lab, but like for our local hospital here, it says normal B12 is 211 to 911. So does that mean if you're 212 or even 300, you're good? No. That is not an optimal level. Those ranges are averages. The way they came up with lab reference ranges is took a bunch of healthy white guys and said, okay, let's check these vitamin levels. Let's check their sodium and potassium and different things. And then let's figure out what was the range of levels that they had. And we'll call that our normal or reference range. So just because something is in range doesn't mean it's optimal and doesn't deserve attention. And you actually need, with vitamin B12 and a lot of B vitamins in general, you need higher levels to be able to get to the nervous system. So you may have a decent B12 level in your plasma, but it's okay if it goes higher because we've got to have it higher to get into the cells, get into the brain, that sort of thing. And along with the intercellular level, there is a test. This one can't be run through your regular lab, but there are two specialty labs that I use. One is Vibrant America, their nutrient panel, and the other is SpectraCell, which is SpectraCell. They both do intracellular nutrient testing. So what your typical lab tests is how much vitamin B, iron, any of these things are floating around in the plasma, okay? They're there available to be used, but they may not be in the cell where they need to be for optimal function. So it's really helpful. I've had two people recently who were taking B12 and taking a good B12 who their intracellular level was not good. So we knew for whatever reason it wasn't being absorbed for them. We opted for some B12 shots. Sometimes you need to switch the form of B12 that you take. There's lots of different things to address that, but we want optimal levels. We want that B12 to be high enough that it's getting to the nervous system, to the brain, and into all different cells. Another thing, if you're looking for root causes of dementia, I actually just participated in a conference that was all about infectious causes of dementia. So there are multiple studies and really good evidence that infection can put someone at higher risk for dementia, including Alzheimer's. I read one meta-analysis recently. What a meta-analysis is it takes a whole bunch of research studies and it does a big review of all of them, and it helps you sort out the different information. So I read a meta-analysis recently that talked about the plaques that are in the Alzheimer's brains. So that's kind of a classic diagnostic finding. But when they did autopsies on these folks and they took those plaques apart, they found that the plaques were actually something called biofilms, where infection was trapped inside. So these plaques were the body's attempt to kind of deal with and close off the infection. But then because of that, they disrupt blood flow and a lot of other things, and they can contribute to that. So one really important thing as you age is if somebody starts to have a change of mental status, if they become more forgetful, more agitated, you don't say, I guess they're just getting older. You say, what could have changed? A classic thing is a urinary tract infection or pneumonia without typical symptoms. So if you're younger and you get a urinary tract infection, high chances that it's going to burn when you pee. You're going to have to go more often. When you have to go, you've got to go. It's that urgency. But there, with older people, can be more subtle symptoms, and one of them is being more forgetful. And I've been really frustrated with the way I've seen this play out in our healthcare system. I became very attuned to that when I was working as an RN in home care. That was just drilled into us. We knew we've got to check for UTI, check for these, what we call silent infections, if there are any mental status changes. But I'm hearing now from more and more people of doctors who are refusing to even test for UTI if the patient doesn't have symptoms, and they are talking about symptoms of pain. But just because there's not pain doesn't mean there's not a symptom. It could be increased incontinence. It's not normal to become incontinent. It could be that you're going all the time at night. That's not necessarily normal. Yes, a lot of people have to get up to go to the bathroom once at night, but if it's multiple times a night, what could be going on? And this is with both men and women. Certainly, for men, the symptom of having a harder time getting your urine stream started and stopped, that could be because of what's called BPH, benign prostatic hypertrophy, which is what's considered kind of like a normal enlargement of the prostate as you age. But what else could cause it to enlarge and kind of constrict your urine flow? That would be infection. And the best way for a male to test for that, you can check the urine, but really, if you want to see if there's infection in the prostate, you need a semen sample, which can be kind of an awkward conversation for some people. If you're not someone who wants to just give a semen sample, we always give people cups to take home. Obviously, we do not do this procedure in our office. Give them a cup. You can either manually stimulate yourself and give a semen sample, or if you wear a condom during sex, then you can take the contents of the condom after intercourse, squeeze it into the specimen cup, and give the semen sample that way. So infection, nutrient deficiencies, those are kind of some pretty low-hanging fruit. I have also seen a correlation with infections like borreliosis, which is Lyme disease, Bartonella, Babesia, other infections that can get to the nervous system. So don't accept that someone's just getting older if they, and if that they is you, especially, start to be more forgetful, see a change. Do a little digging, do a little investigation. Next, we will move on to pillar number 2, which is the immune system. So our immune system is something that we want to protect. We are not doomed to have just a good or a bad immune system. It's something we can do something actively about. Again, there are nutrients that help with immunity. There have been some interesting studies post-COVID, people who fared better or worse with COVID infection. There was an association with levels of certain nutrients. For example, people who had higher glutathione levels. Glutathione's a really important antioxidant antioxidant that your liver makes. They had far less severe COVID symptoms. There was a great study years ago that looked at glutathione levels in ICUs, intensive care units, and this was pre-COVID. By increasing patients' glutathione levels, they had shorter ICU stays and decreased severity of illness. Another one is vitamin D, which is really important for immune function. We're going to talk more about that in our next episode, which will be about seasonal affective disorder. What we eat matters. We have a world, because we have so many opportunities and cool advances, we also have a lot more exposure to toxins than people used to. And our body, those kind of accumulate. And so if you want to minimize the toxins that you're putting in your body, but you also want to help them get out. One of my favorite things for this is, I've mentioned it before, an infrared sauna. Sweating out the toxins is fantastic. You want to be drinking lots of water every day because you want to flush it out. You want to be having regular bowel movements so there aren't things accumulating in your gut. But, with immune function, looking at nutrition, nutrient deficits, and then doing some basic things to help your body detoxify. And the older you get, the more toxins you've accumulated. A great example is surgeries. When you look at surgery, anesthesia is stored in your fat cells. And so it stays with you for a while. That's why some people have some cognitive declines after surgery. One thing you can do is help detoxify through sauna or other means to help get those sorts of things out using the right nutrients. Sometimes we'll even use IVs, but just not accepting that, oh, things are just worse and there's nothing I can do about it. Next, we will move to inflammation. So inflammation obviously is associated with pain, but inflammation in the brain, which you can't see, is affected with inflammation in the brain affects cognitive function. And so doing things to decrease inflammation in the brain and generally is a very positive thing. Now, it's tricky because I could throw out here the name of a few supplements or procedures, things you can do to do that. But if the basics don't work, just remember to look a little deeper. Obviously, curcumin, which is turmeric, is fantastic for inflammation, but it doesn't work for everyone. There's no supplement, pill, anything that's going to work 100% of the time for 100% of people. So you may have to do a little bit of digging with that. Also, movement, exercise, we've talked about it before, will help decrease inflammation. A lot of healthy lifestyle type things. One of the things that we find through the genetic testing that I've referred to is some people are prone to runaway inflammation. They get inflamed because of illness, injury, infection, but their body can't compensate the way it should to turn that off. So we've got to do more aggressive things to decrease the inflammation. That's why some people struggled more with COVID respiratory symptoms, because they were more prone to inflammation in the lungs. So inflammation, as it relates to whether infection or other processes that are going on. And then something that benefits a lot of people is an anti-inflammatory diet. I'm not going to dig into that too much, but if you go take a peek on the internet, anti-inflammatory diet, you'll find things. Another thing that I want to throw out there that is kind of ubiquitous in the older population is the effect of medications. So your medication could be part of your problem. We are fortunate to live in a time where we have so many more things available to treat illness, but there is a pattern of overprescribing, and every single medication has possible side effects. That's not always a bad thing. Sometimes it's worth it. You have to look at the risk-benefit ratio. Yes, there may be side effects to antibiotics, but boy, if you've got sepsis or if you've got a urinary tract infection, for God's sake, please take the antibiotic. You may have horrific blood pressure and a family history of a stroke, and there are side effects to blood pressure medications, but you really need to take medication to control your blood pressure. But you also need to look at, did any of my problems start relative to when I started this prescription? Is there an alternative? Talk to your provider about if you could try a different class of drugs, or if you're taking medicines that you don't really need anymore. I see a pattern that's really frustrating because so many people see so many different specialists, and every specialist has their own favorite drug for that problem, and nobody wants to stop what the other person did. You have people who end up on multiple drugs from multiple different providers, and they're interacting. It's too much for the body. Our body wasn't meant to manage that much medication. So you've got to look hard and fast at your med list. Side effects are a tricky thing. If you look up side effects for any drug online, you can be overwhelmed and terrified, so I tell people to go with caution, because I don't want you to have so much fear that you don't take things that might really help. But if you're having health problems you can't quite figure out, go look at the side effects and say, is it possible this is related to a medication that I'm taking? And this also goes into the whole detoxification issue that we were talking about that affects your immune system and inflammation. Is the more medications you take, the harder your liver and or kidneys, depending on how the drug is metabolized, have to work. So you may need to be doing extra to help that detox process. Finally, we will get to integrity. So integrity can mean a lot of different things. Integrity of body, mind, and spirit is one thing I look at, and the other is being honest with yourself. So one thing that I think is important is having realistic expectations. No matter what, you are not going to feel like you did when you're 20. It's just not possible. You're not going to be able to do all the things you did even in your 30s and 40s, and that's okay. You have to look at, if I can use an analogy, what kind of car you have. The car I drove to work today is a $1,000 Chevy Aveo that has duct tape along the top of one of the windows and kind of shakes when I drive it. So we got it because we have lots of kids who are drivers. We couldn't really afford another good car, and my work is 1.5 miles from my house. So that car is perfectly suitable for going to and from work, maybe going to the grocery store. I would not take it on a cross-country trip. I wouldn't even take it 50 minutes to the next big town, but it's perfect for what it can do. Sometimes in your life, you may be the Chevy Aveo. You may not have the ability to go very far or do very much. So honor what your body has to give, have realistic expectations, and make the most of what you're going to do in your little shaky, sputtery car that's all beat up. There may be times that you are a fantastic, I don't know, Honda Civic, but you only have one tank of gas, and you're trying to do what somebody's going to do with like a gas tank that gets refilled every couple of hours. I don't know, not a perfect analogy, but my point is, look at who you are and what you can do, and then make good decisions about what to do with the energy and health you have. Put first things first. Your most treasured resource is your time and your relationships. So find ways to focus on relationships. I've seen some people as they age just berate themselves and become almost unpleasant to be around, because they are just going to keep doing what they've always done, and it's to their detriment, and it's not really helpful to anyone else. But what you can do is sit with your grandchild, read a book to them, call someone on the phone. Maybe you can't run anymore, but you can go on walks. There's so many things you can do. You just have to redefine what a healthy, successful life is. So it's, I think, an interesting balance between challenging limitations and then being okay with what you're ultimately able to do, because you will never be healthy or feel whole if you're always dissatisfied and always looking back, because I can guarantee that in another 10 years, you'll look back and say, oh my goodness, if I only felt the way I did in 2024, you know? So enjoy 2024 because it's going to be the golden days in another 10 years. The other thing to think about is as physical abilities decline, take the opportunity to do things like mend relationships, write your life history, do a life review, take the chance to evaluate what you have done with your life and be grateful. And if there are things that need mended, mend them. But unfortunately, we may not value our aging population in this culture as much as we should, but you are valuable. You've lived wonderful lives. Your lives aren't over, but redefine what success and healthy living is. Acknowledge and analyze problems as they come, but don't be hyper focused on them because that's not who you are. You are not an old person, a forgetful person, someone with an arthritic gait. You're just a person, you're a soul. You were made to be whole and you're much more than your limitations. So I would encourage you, as you consider healthy aging in the month of September, to not just, if you are at that senior stage of life, look at these factors, but as you are a younger adult and a middle-aged adult, look forward. It's so much easier to prevent than to repair. So if you're 40, don't wait until you're 60 to start looking at nutrition. Don't wait until you start forgetting things to figure out if you have risk factors. Take the opportunity now. Work with the resources that you have, even if you're not able to get a hold of some of the specialty testing that I referred to. I think everybody could ask their provider for a B12 level and a vitamin D level, and they wouldn't have a problem. You may have to push a little, but you could ask for all your B vitamins to be run. So that would be B1, which is thiamine, B2, which is riboflavin, B3, which is niacin or niacinamide metabolites, B5, which is pantothenic acid, B6, B7, which is biotin, and then folate or folic acid, but the test is called folate. So those are all things that are available through your regular lab. And if you can get someone who would be willing to write that, go ahead and write it. I have not had a problem getting any of those covered for insurance if you use codes like fatigue. So your provider always has to put for the insurance company what's called an ICD-10 code, and that's just a diagnosis code that supports why they ordered the test. And so I have not had or heard back from people about these B vitamins not getting covered using codes like fatigue, because even if you don't have chronic fatigue, I'm pretty sure you've been fatigued. If you've had headaches, they can use headaches. If you have chronic pain, I usually use that. And if there are any problems with memory, you may not have dementia, but there's a code for other signs and symptoms relating to cognitive awareness. And I'm actually going to look that up for you now so you can give them the code. So yeah, R as in Roger 41.82, which is also unspecified altered mental status. So those are some things that anyone can ask for, and hopefully you'll have a provider who will, concede that's not a high risk thing. It's nothing you'd have to see a specialist for, and start there. Remember, above all, that you are more than your problems, that you were made to be whole. Take care, and I'll talk to you next week.